Good morning, it's Tamika Chambers here with another question. I believe this question is from Nurses Labs. And so, have you had your water today? Make sure you're taking care of yourself as you study for your exam. A nurse prepares to care for a 4-year-old newly admitted for rhabdomyosarcoma. The nurse should alert the staff to pay more attention to the function of which body of the area. So, of course, we have a diagnosis and we have an age. So those are important keywords. And then function is looking at function. So as always, I recommend that you have something to write with, something to write on. Would it be A, all striated muscles, B, the cerebellum, C, the kidneys, D, the leg bones? And when you put R, as you go through your answers, you put R, you're giving your mind something to think about, because even though you may not know the answer like consciously, your subconscious mind has taken in a lot of information and has access to a lot of wisdom. So when we look at rhabdo, many people, they freak out when they see words like this, because it's like, what the heck does that mean? Sarcoma is usually standing for cancer. There's a word in there, myo. See myo? Myo means muscle. So rhabdo is dealing with some disease of the muscle, if you will, and that's sarcoma, it's cancer. So that kind of already gives us the answer. The answer actually is going to be A, right? So when the key thing about doing this question is to often, one thing I do love about the medical words is there's usually some type of root or prefix or suffix in the word that can help you to make sense of what they're asking you. So before you kind of freak out about it, say, okay, wait a minute, I can figure this out. Let me see if there is something in the word that I can bring out of it to help me make sense of it. That was the reason for doing this question. I love doing them because, again, this is one way to decrease your anxiety, increase your confidence, and know that you can figure it out, your critical thinking skills. I'll talk to you soon. Other than that, you can see the rationales. Rhabdomyosarcoma is soft tissue, skeletal muscles, anywhere in the body. Signs and symptoms is important. Note that. And B, C, and D are not it because they're typically not linked to the disease. All right, talk to you soon.